Hello, myself Fashan Ansan, your 156 and I'm going to explain my second case study lab, that is class diagram. So this is my hospital management system diagram. So here doctors, patient, operation, reception, ward, bill, test, ward staff, department and OPD are my main classes. Here multiplicity takes place, that is one dot star means a doctor can meet many patients. So it includes that one dot star. That it means one or many. Here also the same take place. That is, a patient can consult many doctors according to their diseases. So the testing take place in this way. Then here also a patient undergoes an operation. Then now let's look inside the classes. Here inside the doctors, we have two tables. Like first one is the public private data, then second one is an operation that the class takes. So the first one is that its ID and name. Doctor's ID and name is considered as a private data. Then its operation, that is details, prescribing medicines, prescribing the test, checking the reports. These are the private public things. Now inside the patient, this is the patient ID and it is in a integer. Then patient name is of character. Then the operations is patient's details, pay changes, paying the bills, etc. So these are the things. Then the test is performing here. Now this thing is aggregation. Here aggregation takes place. The test ID and test name is considered as a private data. Then report generation and collection generation is considered as a public data. Here also, between the test and the patient, multiplicity take place. That is one or many. A patient can undergo many tests, so it's considered as a one dot star. Now the operation is that operation ID, operation name, and operation time. ID is considered as an integer. The name and time is a character, and it's a private data. Now comes the reception. Reception also we have two things. First one is the data, and second one is the operation it undergo. And the first one data means registered ID and name is considered as a private data. Then registering the patient, receiving the payment, then the patient's status, everything is considered as a public one. Then there is a connection between patient and a reception. That is, a patient can, if they want to consult a doctor, they have to register in the reception. So the connection is shown there. Now comes the ward. Ward is that ward ID and ward name is considered as a private data, that is of integer and character. Then checking the availability of the ward, then allocating the ward number. And if you don't want that, what means reallocating the ward, that is considered as a public data. Now comes the ward staff. Ward staff's details are considered as a private data, that is its ID, name, and duty of that ward. Here also multiplicity take place. One dot star between ward staff and ward. That is, a ward staff can have a duty in many ward. So one dot star. Then comes the department. Department and a doctor have a connection. That is, there are many doctors of having different duties. Like it depends on their department. Now department ID, department location, everything is considered as a private data, and its details is considered as a public. Here also multiplicity undergoes, that is one dot star, one or many. A department can have many doctors, so it's considered in that way. Now the operation ID and operation ID is considered as a private data, and its details is considered as a public data. Here we have connection like number of, that is, a doctor can perform many operations depending on the disease and their duty. So this is my second experiment, and I hope you all understand. That's all the program. Thank you.